In today's COVID-19 update, the Minister of Health, Dr. Frank Anthony, addressed the criteria for travelers coming to Ghana as well as Guyanese returning home from overseas. Unvaccinated citizens who are returning home to Ghana are required to follow.
So the gazetted orders that was put out by the Civil Aviation Authority clearly states that for someone coming back to Guyana, they have to get a negative PCR. And in addition to a negative PCR, they would be required to have been vaccinated. Vaccination in this instance mean at least having one dose of your vaccine. And this applies to all travelers coming back to Guyana. The exemptions, however, there are some exemptions. So if you're below the ages of 18, you're not required to have a vaccination because in Guyana we are not administering vaccines as yet to persons below the ages of 80. So we have not made that a requirement. Another exemption would be for women who are pregnant, must show proof of their pregnancy, and then we can exempt them because there are some women who, during their pregnancy, did not want to take the vaccine, and that's purely their choice. And once the obstetrician would have exempted them, they can present proof that they're pregnant, and they would not be required to have uh, the vaccination requirement. So those are the two exemptions. Um, there might be other citizens who, for one reason or the other, who have traveled abroad, and because these requirements are now in place, gotten have been out there, and they're now required to travel back. They might not have um, their vaccine. In those circumstances, they can apply to the task force ahead of time, and each case would be dealt with on a case by case basis. We have not set up that facility, but it's something that we can do because we don't expect persons would be coming in without vaccination. Once you take precautions, I think travel is relatively safe. It also depends on the destination um, that you're going to. Some of these destinations, they might have surges of cases, and if you're not careful, you can get infected. So, um, like with everything else, one would have to be very cautious. And if you can avoid travel, well, then you do so. If you cannot, then you take the precautions. The precautions are universal. Those would include masking. It would also include social distancing wherever that is possible, and some frequency in which you sanitize your hands. The latest figures in terms of vaccination, we would have had 271,122 persons who received their first dose vaccine. That now represents 55.7% of our adult population. We also would have seen a marginal increase in our second dose. So we are now at 144,965 persons who would have received their second dose vaccine. That is approximately 29.8% of our population. Since the new measures have gone into place, a lot of people have been coming forward to receive their vaccines, and we are very pleased about that. Just over the last 24 hours, persons coming to our vaccination sites. We had about 4,613 persons who received vaccines at our various vaccination sites. And we had 113 of those sites operating. For first dose vaccination, which I think is a record, we had 3,972 persons receiving their first dose vaccines. And for second dose, we had 641 persons. The vaccines indeed were developed quite quickly, but that's because globally we have more scientists who are working on this problem, more resources that were put to the problem in terms of financial and other resources. And because of so many people working to find a solution, we were able to develop that solution very quickly. So once the vaccine was developed, it went through very rigorous clinical trials. There were three types of clinical trials that it went through. And at each one of the clinical trial, each trial that it went through, it had to be safe and efficacious. And once it passed those trials and it was accredited by an outside body, so to speak, so like WHO, or one of the stringent regulatory authority, then it was given permission to be used on people. So these vaccines are extremely safe, and it's perhaps the first time that any vaccine would have gone through such a rigorous process of evaluation.